A following image is the CT scan of a patient who has intellectual disability, that means mental retardation, and seizure, epilepsy, since childhood. Which finding would you expect in his heart? Now, what do we see in a CT scan? In a CT scan, we are seeing bilateral kidneys which are containing multiple fat containing lesions. Multiple fat containing lesions in the kidney points towards angiomyolipomas. Points towards angiomyolipomas, and you are dealing with a case of tuberous sclerosis. Tuberous sclerosis, and you know what is a characteristic triad of tuberous sclerosis? Epilepsy, low intelligence, and adenoma sebaceum, called as epiloia. Epilepsy, low intelligence, and adenoma sebaceum. Tuberous sclerosis is a multisystemic disease. The disease does not involve just 2-3 parts. Lot of body organs are involved, and an important feature in the heart that is seen in tuberous sclerosis is cardiac rhabdomyomas. So it is not atrial myxomas, it is cardiac rhabdomyomas which are commonly seen in tuberous sclerosis. Next question. A 50-year-old male patient with a history of sustaining an injury to the chest was rushed to the emergency room. Initial evaluation revealed tachypnea, tachycardia, and hypotension. Radiologist performed an EFAST and the image obtained is given below. Now, what is the immediate management? So, what do you see is an M mode ultrasound over here. M mode ultrasound over here. Now, let's see two cases. This is a normal lung and this is a case of a pneumothorax. So, once you do an M mode ultrasound in a normal case in the chest wall, because there is no motion that is happening, you're going to see some parallel line, but because the lung is moving, you're going to see a positive motion which is called as a seashore sign. Whereas in case of pneumothorax, there is no motion that is happening because it is air, and that is why you're going to see only these parallel lines. You're going to see only these parallel lines which have been called as a barcode sign or a stratosphere sign. So this is a barcode or stratosphere sign. A barcode or a stratosphere sign. So that means this patient is having pneumothorax. Now let us see the choices. Immediate needle decompression. Yes, that should be the answer. That should be the answer. Shift the patient immediately for a chest radiograph. No, you already have made the diagnosis. This is not needed. Immediate ICD insertion. No. Wait and observe. No. So the answer is immediate needle decompression. That should be done in this case. A child presented with some skeletal abnormality and the radiograph was obtained and the angle is being measured. What is the name of the angle measured? So what you see is a curved back. You're seeing that the spine is deformed and this is nothing but a scoliosis. So once you have a scoliosis, you measure an angle which is called as Cobb's angle. Now the idea of measuring Cobb's angle is to see the degree of deformity so that a spine surgeon can define the exact treatment that is needed for this particular case. So this is nothing but a Cobb's angle.